there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. The last I read, you see your patients about 5.7 times per year.
We're now 7.1.
And you're now 7.1. That's a fantastic statistic where, average hospitals are seeing their canine patients about 2.9 times per year and their feline patients even less than that. Relative to feline visits, how do you think this concept of genetic predispositions can help drive visits to the veterinary hospital?
I love to talk to purebred cat owners, especially about genetic things. There are a few DNA tests coming out for cats. Just like dogs, there are big risks with some of these breeds. Persian cats, more than a third of Persian cats will end up with polycystic kidney disease. That's something we need to be educating owners about and monitoring. A lot of these cats are going to die of that disease. So just like with dogs, we need to be aware of what the risks are. But I think the major thing that we have to do is to train owners in the first place to come in every year. I think this is where we fall down. So we only have 3 or 4 kitten visits to train that client that that cat needs care its entire life. So many clients think they'll do the initial distemper vaccines, they'll get the dog or cat spayed or neutered, and then they don't have to come back. And so then we don't see that cat again for 10 or 12 years. By the time the client brings it in, it's got 3 different diseases that we could have done a lot more about if we had caught them earlier. A lot of them end up euthanized years before they would have been put to sleep if they had been getting regular veterinary care. So to me, I can't talk about breed-specific risk or any other problems if the client never comes in the door. So I have to educate them from that very first visit. All your cat's life, you need to bring it in every year. We're going to find things that you're not going to notice at home. Even indoor cats have risk for diseases. That's another misconception a lot of people have. Oh, he's an indoor cat, he doesn't have any risk for contagious diseases. Well, yes, they do. And they have risk for parasites too. So almost a third of the cats that get heartworm disease are totally indoors because the mosquitoes come into us. So I need to train that owner to come back. I actually had 3 cases last week. It was a very depressing week of cats that were not that old that came in advanced kidney failure that hadn't been to a veterinarian in years. I had 2 in a row last Monday night. It's so sad when you see those cases. One of them had not been to a veterinarian since he was adopted from the Humane Society in 2004. So he went in, got his Humane Society exam for free, and then never saw a veterinarian again. The veterinarian that saw him for that exam had that one chance to get that client to realize that routine care was going to prolong the life of their cat, give it a healthier life, pain-free. The cat had a whole mouthful of infected teeth. You could smell it as soon as you walked in the room, and his kidneys were failing in part because of those infected teeth. If we had been seeing that cat every year, we probably would have bought that cat 5 or 6 or 7 years of life. We don't get that chance if we don't do a good job at that first visit. So my message to everybody, you can't talk about breed risk or anything else until you get that client to buy in that they need to keep coming in to us every year.
Thank you for dialing in to ask this expert. Dr. Boss, thank you for your time and for your insights.